Hello, everybody. This is Dr. Shreya here, and today we are going to talk about the features of Class 3 malocclusion. We will cover what a Class 3 malocclusion is, a few distinct features that are available, and a few distinct features that are present. And we are also going to talk about the treatment modalities on how to treat a Class 3 malocclusion. So now we very well know the angles classification. It's classified into class 1 molar, class 2 and class 3. Class 3 molar relationship is where the mesial-buccal cusp of the maxillary permanent molar falls distal to the mandibular first molar, right? Which means the mandible is ahead of the maxilla. And anteriorly, the canine is also in a class 3 relationship where the mesial arm of the canine falls on the premolar, like the mandibular premolar. And when come to the incisors, there are two possibilities. The lower incisors can be head of the upper incisors, or it can be an edge-to-edge relation. Coming to the other features, we can classify it as facial, skeletal, dental, and occlusal. In facial, we talk about the facial profile and the facial divergence. As we know, the facial profile is either a convex, concave, or straight, but in a class 3 malocclusion, it is concave, generally concave, but it can also be presented as a straight profile. Now, coming to the facial divergence, it's either a straight divergence or an anterior divergence, which is resulted due to the forward placement of the mandible. Coming to the skeletal features, it's where the mandible is the head of the maxilla, right? When you relate the maxilla to the mandible. But that can be possible because of multiple reasons. One reason being, if the growth of the maxilla is not enough, or if it's a retinognathic maxilla and a prognathic mandible, then it is a class 3. It can also be a combination of orthognathic maxilla and a prognathic mandible, or a retinognathic maxilla and a orthognathic mandible. So it is a combination of these three. Based on these three, the treatment plan also varies. Now, coming to the dental, like we had already mentioned earlier, the molar is in a class 3, the canines are in a class 3, and the incisors can also be in a reverse jet and a reverse bite, or it can also be edge to edge. And in occlusal, generally when you see, there are chances there could be transverse discrepancies as well. And anteriorly, we can make out whether there is a reverse jet or if the incisors are edge to edge, right? Now, coming to the supplementary features, there are a few distinct features in class 3, and they are 4 main features. What we need to realize is or notice is the negative facial convexity, which is proportional to our facial profile, right? It's a concave facial profile. Then maxillary retrusion or deficiency, or the presence of mandibular protrusion or hyperdevelopment, or a combination of the two is possible, which results in class 3 malocclusion. And then the incisor compensation. What they mean by incisor compensation here is, if you look at this step, you can make out that since the mandible is ahead, the lower incisors are upright. And since the maxilla is a little behind compared to the mandible, and there needs to be a contact, the maxillary anteriors are severely proclined. So this is called incisor compensation. Now, coming to assess a class 3 malocclusion, we need to keep in mind that it can also be a true class 3 or a pseudo class 3, and there is something called a compensated class 3. So in a true class 3 is where it is a skeletal issue. Like I said, 3 combinations. Whereas a pseudo class 3 is where there is a C or CR shift or a discrepancy. The center of relation and center of occlusion is not in unison, because of which there is a shift and the mandible comes forward. So when we eliminate this C or CR shift, the mandible automatically will go behind, and that will go back to a class 1 malocclusion. This condition is called a pseudo class 3. Whereas when there is a compensated class 3 is where the skeletally is a class 1, but dentally it can still be a class 3 molar relationship. Example of a pseudo class 2, you can make out that when the patient is opening and trying to close the mouth, but not fully in occlusion, just the anteriors are in contact, you can make out that it is edge to edge. But since the patient wants to occlude, since there is a C or a CR shift, the mandible automatically comes forward and goes back to a class 3 as mentioned here. So this is our dental assessment. Now, coming to the treatment, I'm not going to talk about all the various treatment possibilities available, but this is going to tell you an easy way to diagnose a patient and put them in a different category that will help us realize what treatment plan is required for what type of a class 3 patient, right? So class 3 malocclusion, initially, first we'll have to divide it whether it is a growing patient or a non-growing patient. And if it is a growing patient, we'll have to figure out whether it's a skeletal class 3 or a dental class 3, right? If it is a skeletal class 3, we'll have to figure out what is resulting to the class 3, whether it is the maxilla or the mandible or a combination of the maxillomandibular problem. And based on that, based on these three classifications, you can, you will be it will be helpful to figure out what treatment plan is required. So if it's a maxilla that is retrognathic, then we need a face mask to bring the maxilla forward. If the mandible is prognathic, okay, and if the maxilla is retrognathic, you do a face mask with a chin cup, right? But if or a myofunctional appliance, whereas if the mandible alone is prognathic, we need to ensure that you give a chin cup to restrict the mandibular growth. Okay. Now, coming to the dental class 3 in growing patients, you just need orthodontic treatment, that is braces treatment that's required. Okay. You can do compensation extraction or just finish in a class 3 but get a class 1 canine and a class 1 incisor relationship. It is still a stable treatment plan. Now, if the same thing is there in a non-growing patient that is an adult, you again classify it as a skeletal or a dental. If it is dental, you go for orthodontic, fixed orthodontic therapy. If it is skeletal, whether it is mild, moderate, or whether it is severe. Mild and moderate, you can do camouflage with extraction, where that is called orthodontic camouflage. Whereas if it is a severe class 3, you have to go for surgery. Again, when it is a severe class 3 under skeletal, we have to realize whether it is a maxilla at fault or a mandibular at fault or a combination of the two. If the maxilla is at fault, you do a maxillary advancement. If the mandible is at fault, you do a mandibular setback. So this is like a basic synopsis on how to go about treating a class 3 and a basic synopsis on the basic features that you have to look out when a class 3 occlusion patient comes to you for treatment. Hope this was useful. Thank you so much.